Hello. Hi, my name is Courtney Green. I'm the Director of Communications for UnityPoint Health. I'm also a former reporter. I worked at WHO TV and WDAF in Kansas City. And we're doing something that's new for UnityPoint Health. We want to provide timely and accurate information around COVID-19. UnityPoint will be doing conversations to address issues important to our patients, our families, and our communities. And each week we're going to cover 3 topics. The first one will be a harder news story, harder news issue. The second one will be a call to action, and a third one will be something a little bit softer. So today we're going to be covering PPE, personal protective equipment. The call to action is to make sure you take care of your health and don't let COVID get in the way of doing that, and then there's ways that you can do that. The third is how the community has rallied by making handmade masks and really supported healthcare workers. And we just want to be transparent and help you have the tools that you need to tell stories. Lastly, we want the conversations to meet the needs of print and broadcast journalists. And so we want your feedback. If you have any suggestions or questions, please reach out to me at courtney.green with an E at unitypoint.org. Thank you.
The biggest example of that is we've had our eyes on personal protective equipment since January. And we have a core group of folks who monitor supplies, monitor gaps we have in supplies. We have another team that's following all the latest guidelines that are put out by World Health Organization and CDC. And we're constantly monitoring that to make sure we're matching what we're doing here with what's recommended to keep our staff and patients safe. And above all else, we are trying to be good stewards of that PPE to make sure that we have enough to protect the people who have to take care of patients who have COVID. We're also reaching out to other new partners we never thought of, in addition to our standard suppliers, and saying, how can you help us meet gaps we have in masks or shields or gowns? And it's been incredible the way we've been able to partner with those folks to give us more supplies. As we've developed the guidelines, we've remained flexible both for what we learn and for what we hear from the staff, and we're constantly informing them that this is what's recommended, this is what we have, and this is what we can do to keep you safe. You know, we're a big system, and people say big isn't always better, but in our situation, it is, not just for this, but other reasons, better. Because we're all one system, we can actually look across our entire footprint, and we can respond to shortages in one area with, say, masks, and we can look in another region and say, you know, you have plenty of masks for the care you have to provide. We can send those masks to those other regions to meet their need. And it's true for PPE, it's true for medications. We're building it for even the ability to move staff and clinicians as well. So it is a big benefit when you have to manage something like COVID-19 across the entire state. The line here is, don't let COVID-19 keep you from getting the care you need. And we provided care prior to COVID-19 that helped manage our patients both acutely as well as chronically, including heart disease. And when you need care, now's not the time not to get it. And UPC, UnityPoint Clinic, UnityPoint Health, has, as a system, collaborated to create ways for folks to continue to get the care they need. So certainly we canceled elective procedures, but we have workflows to say if you need a surgery, you can get your surgery, you can get it safely, and we'll manage it like we should. In the outpatient space, in the ambulatory clinics, we have options for patients to come get their care. So initially we were very hesitant about people coming to our clinics till we got our arms around this situation, so we quickly stood up virtual options. So virtual urgent care, which we'd had before, but we actually provided more support for that to provide access. We talked about and created virtual visits, scheduled visits, which is a great way for you to connect with your primary care provider or your specialist about either an acute issue that you don't need to be seen for, or for chronic care management. We also know that people still need to be seen. And so we have created clinics where we have clinics where we take care of patients who do not have acute respiratory illnesses, which is part of that COVID symptom complex, so that we can help separate those patients from our patients who are otherwise well and have chronic disease. And in our clinics, we've created an environment that helps them feel safe and keep our staff safe as well. So, for example, waiting rooms, place where everyone gathers, everyone's close to each other, and we know now's the time to social distance, and that's not very possible in our old standard waiting room. So we have physically changed our waiting rooms where people still come in by separating our chairs by 6 feet, making sure you're not there long, get you into your room with your physician and your staff, and have you exit the clinic rather than stand in line to check out. Even more exciting is we've created a virtual waiting room. So we have an option now where we can actually connect a patient to an app that allows us to text that patient, let them know when their appointment is, have them wait in their car, text them when we're ready to have them come in. We meet them at the door, we put a mask on them if they need it, we wear a mask, and we escort them right back to their room. That's important because some patients do need to be seen. And it's better to have them seen in that clinic than it is to go to the emergency room, particularly now. Lastly, it's important to, you hear about hand washing, you hear about social distancing. Well, it's also important to clean. And all our offices are cleaning after visits, every visit, and we're being very attentive, even more than usual, to make sure our surfaces are clean so when patients come, they can feel safe. So there was just an article today in one of the journals I follow about the concern that young children are not getting their vaccines. And when we start letting people get a little closer together, there's great concern that some of the diseases we had under control, measles for example, will come back because we've missed those vaccinations. It is very important, particularly while we're trying to manage COVID, that we keep our vaccinations up to date for those diseases we have vaccines for. That's especially the pediatric population. So we are actually setting up appointment times for those wellness visits for vaccines. We are, again, as we said, setting our clinics for safety, and we're also having those kids come in groups if there's several members in the family. Also, in the morning, we're trying to put our kids in the morning so that those with chronic disease and potentially someone who may be a little easier to manage in the afternoon when the clinic has been busy and people in and out, we get those kiddos in before we get started in the day, get their visits done in the morning, and then they're not missing their appointments.